Dear learners, now in this section we shall study beneficial health effects of spices and their bioactive compounds. Spices have been reported to have various beneficial effects on human health, which include anti-sclerotic, anti-thrombotic, anti-carcinogenic, anti-inflammatory, anti-rhythmic, anti-rheumatic, gastroprotective and lipid lowering action. In addition, spices have radioprotective, that is they protect against radiation, anti-allergic and anti-malarial effects. Spices inhibit the oxidation of low density lipoprotein and protein glycation. Many spices are highly potent antiseptic because they have an antibacterial, antimicrobial and even antiviral effect. Now, first is spices and management of cardiovascular diseases. Some spices play a critical role in the management of heart disease because these spices have been shown to inhibit enzymes involved in lipid synthesis, decrease platelet aggregation, prevent lipid peroxidation, reduce LDL, that is low density lipoprotein levels, and increase coronary blood flow. Now, in this table, major bioactive compounds of spices with potential beneficial effects for the management of cardiovascular diseases have been given. Cinnamon has procyanidin and cinnamaldehyde. They are antioxidant as well as antimicrobial. They increase coronary blood flow, provoke pituitary induced reduction of blood flow, reduce peripheral vascular resistance and increase cardiac contractile force. Ginger contains gingerol and shogaol and it has antioxidant and anti-inflammatory properties. There is reduction in platelet aggregation, they reduce LDL cholesterol levels, reduce LDL atherogenic modifications, reduction in the oxidative response of macrophages. Garlic contains allicin, it is an antioxidant. It inhibits enzyme involved in lipid synthesis, decrease platelet aggregation, prevent lipid peroxidation of oxidized erythrocytes, increase antioxidant status, inhibit angiotensin converting enzyme. Turmeric contains curcumin and capsaicin. It has antioxidant and anti-inflammatory property. It reduces platelet aggregation, decrease triglycerides, reduce thromboxane, decrease serum cholesterol and decrease cardiomyocytic apoptosis. Onions they contain polyphenols, flavonoids and flavonols. They are antioxidants. They reduce platelet aggregation, reduce cholesterol level, enhance blood fibrinolytic activity. Red pepper contains curcumin and capsaicin and it has antioxidant and anti-inflammatory property. It reduces it is a hypotriglyceridemic effect. It reduces cholesterol in blood and liver. And next is fenugreek. Fenugreek has repenticin and isovitexin compounds which works as antioxidant and anticarcinogenic. They have a property of lymphatic cleansing, they decrease blood pressure and it has hypoglycemic effect. The spices fenugreek, red pepper, turmeric, garlic, onion and ginger were found to be effective as hypercholesterolemic agents under various conditions of experimentally induced hypercholesterolemia, hyperlipidemia. Further, fenugreek, onion and garlic are effective in humans with hyperlipidemic condition. Curcumin and capsaicin, the active principles of turmeric and red pepper respectively, are also efficacious at doses comparable to calculated human daily intake. Extracts of garlic and onions inhibit platelet aggregation and lower cholesterol levels. According to Lean 1994, the antiplatelet aggregation, the antiplatelet adhesion, and the anti-proliferation properties of aged garlic extracts appear to contribute more to cardiovascular protection than do the hypolipidemic properties. Apart from the hypocholesterolemic effects of capsaicin, its beneficial effect on overall lipid metabolism under different conditions of lipemia has also been reported. The second is anti-lithogenic effect. The anti-lithogenicity of curcumin and capsaicin is considered to be due to lowering of cholesterol concentration and enhancing the bile acid concentration, both of which contribute to lowering of the cholesterol saturation index and hence reduce crystallization. In addition to their ability to lower the cholesterol saturation index, the anti-lithogenicity of these spice principles may also be due to their influence on biliary proteins. Now, third is anti-diabetic potential of spices. Bioactives from chili peppers, cinnamon, ginger, turmeric, fenugreek, rosemary and garlic may be beneficial in the control of glucose intolerance and diabetes. Chili peppers are associated with a decrease in insulin levels and healthy insulin in human trials, while the doubly linked phenol type A polymers in cinnamons is the bioactive responsible for the control of glucose intolerance and potentiates insulin action. Ginger, on the other hand, can prevent and or inhibit protein glycation, which has been implicated in diabetes. Turmeric has been shown to improve glucose indices and decrease glucose in serum. The extract of fenugreek seed improved insulin signaling and sensitivity and was comparable with metformin, a drug used to treat high blood sugar. The soluble fiber in fenugreek helps to maintain healthy glucose absorption. Rosemary activates PPAR gamma, leading to lower levels of glucose, an inhibitor of alpha glucosidase, which may help to reduce sugar absorption. Garlic powder tablets, that is Alisor, lowered fasting blood glucose. Now, fourth is digestive stimulant action of spices. Spices that stimulate bile acid production by liver and its secretion into bile include curcumin, that is turmeric, capsaicin level, that is from red pepper, ginger, cumin, coriander, ajwain, fenugreek, mustard, onion and tamarind. Spices such as curcumin, capsaicin, piperine, ginger and mint have also been shown to stimulate pancreatic digestive enzymes like lipase, amylase, trypsin and chymotrypsin, which play a crucial role in food digestion. A few spices have been shown to have beneficial effects on the terminal digestive enzymes of small intestinal mucosa. Thus, many of the common spices act as digestive stimulants by enhancing biliary secretion of bile acids, which are vital for fat digestion and absorption, and by stimulating the activities of pancreatic and intestinal enzymes involved in digestion. Now, fifth is anti-mutagenic and anti-carcinogenic properties of spices. Among phytochemicals, the anti-mutagenic effects of curcumin have been studied most widely. Mustard is another spice used for flavoring and as a source of edible oil. The active principle of mustard, namely dithiolthione, is also used as an anticystosomal drug. Cloves, nigella, black pepper, garlic and ginger have been used against cancer. Aged aqueous alcoholic extraction of garlic was also reported to be potentially effective against certain cancers. The following compounds contained in the spices have anti-carcinogenic properties like curcumin, epigenin, luteolin, quercetin, thymoquinone and isothiocyanate. Now, it has been found turmeric, it prevents from rectal cancer, oral cancer, leukemia, carcinoma of head and neck. Saffron, it protects from skin carcinoma, rectal cancer and hepatic carcinoma. Garlic contains allicin which protect from prostate cancer, colon cancer. Onions, it prevents from gastric carcinoma. Turmeric, again it prevents from leukemia. Mustard prevents from rectal carcinoma and bladder cancer. Bay leaf, it inhibits melanoma of cell growth, and mustard seeds, they protect from rectal carcinoma and bladder cancer. Several studies indicate that curcumin can suppress both tumor initiation and tumor promotion. Curcumin has been demonstrated to have anti-tumor effect in animals treated with potent carcinogens. Garlic is yet another spice widely studied in recent years for its chemopreventive potential. Pungent vanilloids, especially 6-gingerol, present in the widely used dietary spice ginger, have been found to possess potential chemopreventive activities. The bioactive compounds of spices exert their anti-carcinogenic effect by one or more of the following mechanisms, namely by virtue of their antioxidant property, by deactivating the carcinogens or by enhancing the tissue levels of protective enzymes in the body. Protective factors in the spices like turmeric, mustard and onion may act in more than one way to confer their beneficial effects. There is another class of bioactive substances called phthalates, which have anti-carcinogenic potential. They are found in umbelliferous plants like celery, parsley, cumin, dill, fennel and coriander. The phthalates are known to increase the glutathione S transferase level. Now, sixth is antimicrobial activity of spices. The antimicrobial property of turmeric is well known. Its active principle curcumin is the known bacteriostatic agent, whereas the essential oil of turmeric is bacterial and fungistatic. Furthermore, antibacterial properties of garlic and onion were described by Louis Pasteur. The sulfur containing compounds from these plants act against both gram positive and gram negative bacteria. The extracts of garlic and onion are known to inhibit growth of many pathogenic fungi belonging to Aspergillus, Candida and other species. Other spices like nutmeg, saffron, cumin and thyme have antimicrobial potential. The volatile components of these spices are believed to be responsible for this property. These effects have been observed using raw form. Now, next is the other beneficial physiological effects of spices. There are other benefits of bioactives from spices and herbs such as enhancing nutrient bioavailability given by pepperin, weight management and satiety obtained by chili pepper and ginger, fenugreek and pepperin, gut health promoted by chili pepper and turmeric, antibacterial and antifungal obtained by eugenol and cinnamaldehyde from cinnamon, then hepatoprotective effect against carbon tetrachloride, that is given by ethanol extracts of cinnamon, Then neuroprotective, again it is given by cinnamaldehyde from cinnamon. Then reduction of nausea and vomiting during pregnancy or after chemotherapy, again that is obtained from ginger. Then joint and muscle health, again from ginger. Digestion aid from black pepper. Then lipid metabolism and vascular health, which is obtained from fenugreek and rosemary. Then chemopreventive and anti-carcinogenic, that is given by rosemary. Then anti-thrombotic and anticoagulant, that is done by garlic, and immunomodulatory activity given by garlic. Prevalence of cardiovascular diseases as correlated to diets in which spices play an important role. Now, let us conclude. Spices are important food adjuncts that have been used as flavoring and coloring agents and as preservatives for thousands of years. Some spices like fenugreek can also modify the texture of food. It is a common experience that their distinct aroma stimulates the appetite. Spices have also been recognized to possess medicinal properties, and their use in traditional systems of medicine has been on record for a long time. Recent researches have documented digestive stimulant action, hypolipidemic effect, anti-diabetic influence, anti-lithogenic property, antioxidant potential, anti-inflammatory property, anti-mutagenic and anti-carcinogenic potential of spices. Among these, the hypocholesterolemic and antioxidant properties of a few specific spices have far-reaching nutraceutical value. These beneficial physiological effects also have the potential of possible therapeutic application in a variety of disease conditions. Thank you.